The CDC reports more than 37 million Americans, more than 1 in 10 are living with diabetes, and nearly 23% of them are undiagnosed. Another 96 million are at risk of developing it. And that's why we're happy to welcome Shannon Bailey with Ascension Medical Group to talk about this important topic during Diabetes Awareness Month.
Thank you for having me.
No, we're so glad you joined us. This is an important topic that affects a lot of people. So first we want to start off, what can you identify type 1 and type 2 diabetes for us?
Absolutely. So type 1 diabetes is an autoimmune disease. We used to call it juvenile onset, but now we know that it can happen at any time of life. The average age of onset is about 11 or 12 years of age. It causes a complete lack of insulin in the body. So type 1 patients need insulin to survive. Type 2 diabetes is a little bit different. It's caused by insulin resistance. Your body just isn't able to use the insulin properly, and over time can actually lose the ability to produce enough insulin. So that's why you see some people with type 2 also taking insulin.
And when it comes to identifying symptoms, how do people know that they may have it and they need to seek medical help?
Sure. Some of the common signs and symptoms that you may have high blood sugar would be extreme thirst, blurry vision, going to the bathroom a lot, like urinating a lot, dry mouth. Sometimes if you get what we call DKA or diabetic ketoacidosis, the person can actually have a fruity flavor or kind of acetone smell to their breath. And that would be a big red flag to get into the doctor.
And so when they come into like someone like Ascension Medical Group, what kind of services are you able to offer to test them?
Well, we typically don't test them. They would get tested at their doctors. We would usually bring them in for some education. We've got diabetes education classes, advanced insulin management classes. We've got gestational diabetes classes, pre-diabetes classes, which is really important because there are 96 million people, like you said, at risk for type 2. Pre-diabetes is the precursor for that. So if you intervene early, you can actually save yourself from getting that diagnosis of type 2 diabetes.
And if you are diagnosed with it, what are some treatment options?
Sure, there's lots of medications. The cool thing about diabetes right now is it's quickly changing. We've got a lot of diabetes devices, wearable technology that can, eliminate the need to finger stick to check your blood sugar. Insulin pumps are on the market now.
So technology is really helping.
It is huge. A lot of new diabetes oral medications. Some of them actually protect your heart and your kidneys, in addition to helping lower your blood sugar. So there are a lot of new medications on the market.
That's great to hear. And when it comes to effectively managing diabetes, what do you have to say to people that may be dealing with this?
It really is a balance of the food or the nutrition that you're putting into your body, the exercise that or the physical activity that you're doing, and then the medications too. If any one of those things is out of whack, your blood sugars are not going to be really well controlled. The other thing that I tell people is education is power. A lot of people think they know about diabetes, but when they come to see us, they learn so much about their body, about how their medications are working, and how to better take care of themselves.
Perfect. Well, thank you so much for joining us. We appreciate it.